Good day, I'm Dr. Courtney Campbell with Vet Candy. As a veterinary surgeon, I'm normally talking about fun surgical topics like how to win at intestinal surgery, how to fight osteoarthritis, or even the intersectionality between infectious disease and surgery. But today, I want to talk to you about something different, something I rarely get to talk about. I want to talk about alternate career paths and how to land your dream job. Today, I want to explore creative career ideas for veterinarians seeking flexibility, personal fulfillment, a non-clinical job, or simply a better work-life balance. More veterinarians are choosing not to follow the typical veterinarian career path. And I'm not going to bore you with my entire bio right now. But whenever I listen to a speaker, I always think it's helpful if I know a little bit about their background. So here's just a quick Cliff Notes version of my journey thus far. When I started veterinary school, I was convinced I wanted to be a veterinary radiologist. I secured a radiology internship, and I was ready to go. Then the school lost funding for the position, or at least that's what they told me. But that turned out to be the best disappointment that could have ever happened to me because I became hooked on surgery. I worked in a general practice doing surgery, and then I was residency bound. But the residency god said, no, not so fast. So I did one rotating internship and I didn't get that radiology residency. So I did one surgical internship. I didn't get the surgery residency. Then I did another surgical internship and I still didn't get the residency. But alas, I persevered and I ended up achieving that dream. But along the way, I've also had some extremely fulfilling endeavors. I worked at the National Animal Disease Center doing research on prion diseases. I had fun being an adjunct professor at the University of Hartford. And for the past 9 years, I've had fun being a veterinary journalist and a television pet health correspondent.
And host of the Nat Geo Show Pet Talk, Dr. Courtney Campbell.
Dr. Courtney Campbell.
Dr. Courtney Campbell.
So that has been a lot of fun. And now I'm also the Chief Creative Officer of Vet Candy. But thinking about my journey made me think about how fortunate, or in this case, fortunate, we are to be in this great profession. It truly is the greatest profession in the world because of our ability, talents, and gifts to help a variety of species. An alternative career path for a veterinarian could look a lot like my example I just gave you of a young veterinarian completing a residency and going on to become a veterinary journalist or a veterinary medical correspondent. Or perhaps a veterinarian recently completed school and wants to move abroad to practice with an NGO and then come home to do nonprofit consulting. Or maybe you're a veterinarian inventor, leaving medical practice to patent an idea and then sell it to a global conglomerate. Or maybe you're a mom who loves the profession but left to start a family, but now you rejoin the workforce on a part-time basis as a writer and a telemedicine consultant. There are literally a litany of different possibilities, and that's what I want to talk about today. This discussion is aimed at those looking to find their dream job. It's also a friendly shout out to employers who are looking for their dream candidate. Towards the end, we'll touch on a topic that's really important to me, and that's diversity in the workplace. So let's jump right into it. Whether you're a retiring veterinarian or a veterinarian looking for a second career, or you're a veterinarian who just wants to work from home, or simply facing burnout and looking for a career alternative, we're here to help you explore your options. Why veterinarians are leaving medicine? Let's talk about that. Increasingly, veterinarians are not happy with their jobs. Blame it on an overloaded veterinary healthcare system, longer hours with minimal pay increases, heavy requirement for documentation, increasing higher education costs, or even more demanding clients. The patients, well, for me, they're usually the highlight. But the truth is, veterinarians are citing burnout at the highest rates in history. But rather than dwell on a troubled system and feel regretful about your career choice, it's time to get empowered. Leverage your veterinary medical expertise and harness your skills and passion into a career that fulfills you both personally and professionally. A veterinary degree and veterinary medical experience is a valued asset in the private sector, and there are multitudes of career options out there for burned out veterinarians. The traditional path for veterinarians is something we probably all heard. Versions of this, like veterinary school, internship, general practice, or no internship and straight into general practice. And for many, this path is wonderful, and it leads to a fulfilling career of helping pets and restoring families. But perhaps you're seeking a non-clinical career, or maybe you want something different. Whether it's a non-clinical career transition, or you're looking for that elusive 9-to-5 job within the veterinary profession, here is a mixed list of traditional and alternative veterinary careers for former veterinarians, retired veterinarians, or burned out veterinarians who simply want a career change. Here, let's just quickly discuss a few examples. Medical education jobs for veterinarians. Teaching can be an impactful outlet for veterinarians wanting to leverage their medical expertise and inspire the next generation of care providers. Joining the faculty at a university, writing a course curriculum, or developing CE programs could all be options for veterinarians in education. If you're open to research, teaching at a major university could be a compelling path, while community colleges and vocational schools often seek veterinarians for part-time teaching without research commitments. Corporate veterinary jobs and insurance medicine. Listen, corporate veterinary medicine jobs include working for pharmaceutical or health insurance companies. Corporate veterinarians and doctors working for insurance companies trade their lab coats for suits, but still leverage much of the veterinary medical expertise garnered throughout school and in private practice. Health insurance veterinarian jobs could entail conducting remote medical chart reviews or helping develop policy and guidelines for insurance policy coverage. Pharmaceutical veterinary jobs could support research and product development, as well as advise on corporate growth strategy. Veterinary healthcare consulting is needed at the hospital level, for pharmaceutical companies, for veterinarian groups and labs, at government agencies, for medical device companies, and for nonprofits. As a veterinary healthcare consultant, you might advise workplace culture, technology integration, financial management, research and product development, or veterinary healthcare access. Medical writer, editor, those are options. Expert health writers and editors are needed for textbook development, test prep materials, peer-reviewed articles, pharmaceutical and medical device companies, and healthcare publications like magazines and websites. Medical writing can often be done remotely and on your own schedule, making it a good alternative for those looking for ultimate flexibility. At the intersection of medicine and finance are some interesting roles for numbers-driven veterinarians. Venture capital funds leverage veterinarians to advise on the viability of investments. Veterinary healthcare nonprofits use veterinarians for fundraising, assistance in biotech, pharmaceutical, and medical device companies. Veterinary expertise as industry analysts. Expert witness, medical malpractice experts. Getting sued is every veterinarian's worst nightmare. So signing up to be an expert witness can feel like joining the dark side. However, medical experts work both sides of the aisle, defending veterinarians' decisions as well as supporting clients who may feel like they received care below the standard level. Knowing you help defend justice can feel good no matter which side of the judgment the decision falls. If you're open to being cross-examined and sitting through a courtroom trial, signing up as a medical expert could be an exciting opportunity that is both intriguing and could supplement your veterinarian income. Medical startup entrepreneur. Some people with veterinary degrees are finding veterinary entrepreneurship and startup career paths to be a better way to impact healthcare delivery and ultimately more patients' lives. Working on devices and innovative medtech has the potential to impact many more lives than a veterinarian would be able to touch in, let's say, a traditional practice. For those non-risk averse or joining a fledgling life sciences company, that could be an interesting career transition. an inventor, a veterinary inventor with hands-on experience. Veterinarians are primed for developing solutions they face at the bedside or cage side every day. Take a little creativity, a lot of perseverance, and a little bit of risk, and you've got the formula for a modern day veterinarian inventor. From the stethoscope to stenting, veterinarians are at the heart of some of the most groundbreaking medical inventions. Anatomic pathology, forensic medical examiner. Listen, if you've got a thing for true crime, then transitioning to a forensic medical profession could be up your alley. Hey doc, my dog passed away and I think it's because somebody threw something over the fence. Most of the time, it's not poison, right? Veterinary forensics is a job that's often part of a public agency, such as a police force, and typically relates to human crime. Depending on the duties, people could be out in the field gathering data or analyzing it in a lab. This will likely require a return to school with a residency and fellowship training in forensic pathology. But mystery lovers, they could find this path much more rewarding than traditional clinical medicine. There's online jobs. Online veterinary jobs as a journalist, teaching, writing, and telemedicine are all opportunities for veterinarians to work remotely from home online. Course development and editing, writing, these jobs can often be done on your own schedule or from companies across the nation. Telemedicine jobs are flexible and contribute to a part-time supplemental income or provide a full-time salary. Let's talk some labor statistics. Veterinary labor statistics. I say do it for the passion, not for the profits. The Bureau of Labor Statistics reports that in 2018, vets earned a median salary of about $94,000. The best paid veterinarians earned $162,000, while the lowest paid earned $56,540. Overall, veterinary medicine is a stable profession. Right? It's a stable profession with a salary that tends to increase steadily with each year of practice. The Bureau of Labor Statistics projects 15,600 new jobs will open in the field by the year 2028. Veterinarian jobs are set to grow by about 18%, but there's still a veterinary shortage. Nearly 20% of veterinarians are anticipated to retire in the next decade. The number of veterinarians has been increasing by about 2.2% every year for a decade, but will that growth be enough to meet the demand? And is the increasing number of graduates the solution, or is there another way to address the veterinarian shortages, especially those happening right now? The AVMA analyzed the AVMA membership database. Of the roughly 113,000 veterinarians living in the United States in 2018, currently 1 out of 3 veterinarians is a baby boomer, and 60% of these baby boomers are practice partners or owners. Extrapolating from that data means that in 5 to 10 years, half of those baby boomers and the rest of the silent generation will retire. This equates to 20,000 of the most experienced veterinarians leaving the workforce. Of the 197 areas considered to have a shortage of veterinarians, Delaware and West Virginia were among the states that were the highest, with between 2,000 and 3,000 housing units for each veterinarian. And it definitely shows in the numbers nationwide. The mean monthly number of searchable jobs on the AVMA Veterinary Career Center website recently has been 5 times the mean monthly number of new job seekers. That disparity is happening despite the profession consistently growing as more and more veterinarians graduate. The 2.2% growth rate of veterinarians per year may accelerate further now that more veterinary colleges have opened, including the University of Arizona and Long Island University. In addition, class sizes are growing. Current estimates predict that the graduating class of 2029 from U.S. veterinary colleges will have 4,000 people compared with around 3,200 as it is currently. But increasing the number of seats in veterinary schools may not be the solution to the shortage issue. The onus should shift to practices to offer more competitive salaries. In addition to years of experience, other factors influencing a veterinarian's salary include the type of practice, geographic location, and whether the vet is a partner or an associate. Here's a compensation overview. As I just mentioned, the salaries for veterinarians are pretty stable. Veterinarians surveyed by the AVMA reported 67% of veterinarians' incomes were between $60,000 and $150,000. Starting salaries for veterinarians, most veterinarians specialize in an animal category, meaning small animal, large animal, or exotic, and earnings depend on the type of veterinary practice in which they're working. The AVMA found some variations in starting salary based on the area of specialization. And by their definition, companion animals included domestic pets such as dogs, cats, and other animals like rabbits, gerbils, and hamsters. Companion animal veterinarian practices employ the most veterinarians. According to the 2019 AVMA Economic State of the Veterinary Medical Profession, small animal vets start at a mean salary of $87,000 a year. The starting salary for large animal exclusive vets is about $75,000 a year. Mixed practice vets also start with an average salary of $75,000 a year. Equine vets start at the lowest salary, just above $50,000 a year. These are both the lowest paid and the least common vets in the United States, equine vets. Veterinary salary, of course, varies by experience level. And for me, it wasn't a tough decision to pursue an internship because I was pretty focused on specialization, and I knew an internship was required. The average salary of veterinarians steadily increases as they gain more experience. An internship after veterinary school may be required to gain additional experience if you're a vet that wants to specialize. Most veterinary postgraduate internships are paid, although it's often at a lower rate than an entry-level job. I have a really strong opinion about unpaid internships, but we'll save that for a future presentation. Compensation during your internship. Just how bad is it? Well, first, pursuing an internship is optional, right? That's key. However, internships are a path towards specialization and potentially higher earnings. An internship is also an opportunity to gain mentorship, and that experience will help you climb faster in the industry. According to the AVMA, vets who start their careers with an internship receive a mean starting salary of around $33,000. But as an entry-level vet, an increasing number of graduated vets start directly in public or private practice and begin receiving entry-level salaries. First-year vets can expect to earn an average annual salary of between $70,000 and $85,000, according to the AVMA. And if you're a mid-level veterinarian, after practicing veterinary medicine for a few years, veterinarians begin earning closer to the national average salary for vets, which is $84,555. And that's annually, according to pay scale. Some private practices offer profit sharing and bonus incentives for their experienced doctors. Also, mid-level vets caring for companion animals are in higher demand and are likely to make above the average salary. And finally, the experienced vets. The AVMA reports that veterinarians with board certification in a specialty area command average incomes exceeding $150,000 a year, while PayScale reports that the salary of an average generalist is between $88,000 before profit sharing and commissions. Maybe being a practice partner is right for you. Late career vets, which are partners, average salary is around $92,000 a year and can be as high as $143,000, including regular salary, profit sharing, and dividends. So if you're considering an alternate career path because of the income, you may first want to inquire about practice ownership. So now that we've touched on some of the traditional paths for veterinarians, let's talk about non-traditional paths for veterinarians. Veterinarians work in a variety of industries in addition to private and veterinary practices, with law enforcement and military branches using more animals to assist with security and locating contraband. Local and national governments now require veterinarians. Some veterinarians conduct scientific research, and others hold faculty or staff positions in veterinary schools. There's opportunity in consulting as well. A vet consultant can average around $150,000 a year. These vets may practice on animals while also providing industry guidance to other practices. Research and education. Veterinary professors earn an average salary of $120,000 a year. As in all medical fields, discoveries further enable more sustainable treatment of diseases and disorders. The same is true in the field of animal care. Vet researchers earn a median salary of about $110,000 a year. Government and military. Veterinarians working within the federal government or the armed forces can also generate a mean income of $100,000 a year. These vets often work with dogs such as therapy or security dogs. State and local governments need vets for their law enforcement dogs and other animals critical to government work. Also, government-funded animal control facilities need vets to assist with diseased animals. These vets do about as well as financially as federal and military vets, with an estimated annual income of $100,000. Nonprofit practices. Nonprofit rescue organizations with a veterinarian on staff could earn a mean salary of about $90,000 a year. So how do you go about finding one of these alternate career jobs? Sometimes a job search feels overwhelming, especially if you need a job right away. It often feels like there's too much to do in a very limited time. One way to manage this stress is to enhance your job search and break the process down into small, manageable steps. Doing so can help you feel like you've accomplished a little piece of your search every day, and you'll make slow and steady progress towards your goal of finding work you really want to do instead of work you have to do. If you accomplish one small goal per day, you can accelerate your job search and find a job quickly. Let's talk resources. What's out there? So basically, we've just briefly touched on the incredible opportunities out there, but you can't score a great position unless you're ready for it. Well, that's not necessarily true. Sometimes you fake it until you make it, but you never really want to rely on that as an option. So it's best to be prepared when opportunity comes knocking. So how exactly do we do that? Some experts meticulously break down the process of finding your dream job into 30 steps. From the first stages of the job search, writing a resume, reaching out to contacts in your industry, to the final stages, preparing for an interview, sending a thank you note, accepting or rejecting a job. Each tip suggests doing one thing per day to help the process of your job search. Doing something every day to find work keeps you from feeling frustrated and focuses your job hunt on work you're actually qualified for. Resumes. I know some vets or even vet students that haven't updated their resume in years. I really believe that resumes, cover letters, interviews are all about showcasing your identity. It answers the question, who are you? Or the question that so many dread, so tell me about yourself. We are individuals with a unique and special set of gifts, talents, and passions. Indeed, you are unique in your interests and your vision, but how you choose to communicate that interest, that passion, for the purposes of getting your dream job, well, that's a way of highlighting your brand. You build your brand by clearly communicating your vision and career goals, and this is where you show your passion. Cover letters, in my opinion, are your chance to sell yourself. They explain why you're the right fit for that position and why you should end that letter with a call to action. Your resume or your CV documents the skills or character traits that make you right for the particular position you're seeking. The way to look at a resume and a cover letter, to me, is simply a means to get an interview. They shouldn't be looked at as a substitute for the interview itself. Because if you set it up just right, you'll know exactly the kinds of questions they'll ask you. Because, quite simply, the interview is your chance to sell yourself in person. Have you heard of the 10-second glance? Well, 10 seconds, it turns out, is a very long time when you're just sitting here on the other end of a computer. But if I gave you 10 seconds to look at a CV, it would probably feel like an eternity. But the truth is, 10 seconds is the average amount of time an employer is going to take a look at a resume before he or she decides to read it or learn more about you or just toss it out. Very briefly, we are going to discuss how a resume or CV can really hook a reader and make them want to learn more about you, allowing you to get your foot in the door for that interview. As I mentioned before, I look at resume as a means to build a brand or a means to achieve an interview. Our brand as veterinarians, as professionals, is asking a simple question: what makes you unique? The resume should highlight your strengths, your interests, your passion. If you spent much of your career in school, then highlight your education as a strength. If your time has been spent gaining experience, then perhaps you should list that first. You should be exceptional to get exceptional. But how exactly do we highlight our exceptionalism? Most of you probably want to be at a practice with great compensation, respect from your colleagues, including your boss, an excellent and well-trained team, a practice that believes in above-average medicine and resources for you to do your job. Almost all of us want to be at that high-end, exceptional practice. Unfortunately, the average practice, it's not that. And the average job applicant is not that either. There is nothing wrong with being average, but if you're saying that you don't want to be average, you want to be exceptional, then we have to present ourselves as exceptional. So how do we do that? Passion equals brand. The word branding can make some people bristle because they don't like to think of their interests as being a tool for marketing or promotion. Those interests and passions we have are sacred to us, and they can be part of our personal identity. But the difference here is that we want to pique the interest of our employer so that we can figure out if this is the right career path for us and if we're right for the employer. An employer can tell when somebody wants a job and when somebody just wants a career. Your passion could be ownership, it could be veterinary dentistry, it could be acupuncture. Find something you can be passionate about, something that is going to keep you getting up in the morning and giving you at least more good days than bad days there in the hospital. So who are you really? Many have heard the phrase, find your why. If you aren't familiar with this phrase, it's a phrase that was popularized in a TED Talk that helps us convey why it is we do what we do. For me, I always encourage those looking for their dream job to focus on other ideals as well. Their how, their where, and their what. These three extra questions help you explain your why. Well, how did you do it? Did you pursue your dream by moving across the globe and not taking no for an answer? Your where. How did the location of your upbringing or your work influence your life choices? Did you have environmental or structural barriers in your way that you had to fight through? And your what? What did you do when someone told you couldn't do it? Did you shrink and recoil, or did you marshal all of your inner resources and fight even harder? Your personal brand is your why. Then comes your core values and the skill set you build. With those three things, you can tap into your professional network to let people know who you are. And just a quick word about cover letters. Consider this question. Do you consider yourself a salesperson? What I have found in our industry is that very few of us consider ourselves salesmen or salespeople. It can be very difficult to talk about ourselves. In fact, I don't really like selling myself. I have found for the most part, veterinarians and people in our profession tend to be humble, which is a great trait. But in this particular instance, your job is to promote yourself and to back up what makes you unique. Because I don't like selling myself. I prefer to look at the information of health and wellness as the sale. I'm simply a vector to give that information. If you're not into selling yourself either or salesmanship, then borrow my mentality of being a vector of information. Have the attitude and the mindset, especially during interviews or when you're drafting a cover letter, that you're simply a vector for information, but the information is about you. You're giving scintillating information about your skill set, character traits, experiences, but in a fun and informational way. If you're looking for a job as a zoo veterinarian, explain what you learned on your multiple internships at zoos. Maybe tell a personal story or share a fun fact. Did you know that elephants can pass the mirror test? In other words, they can recognize their own reflection. By sharing that, the information is the sale, and they are drawn to the person sharing that information. What I recommend to achieve that ideal cover letter is to have roughly 4 to 5 paragraphs. The first paragraph is why you're writing. The second paragraph, why you're qualified. Third paragraph, you can highlight an interpersonal skill. Fourth paragraph, why you are the right fit. And the last paragraph should be a call to action. Of course, there are variations on this model, but overemphasis on any one of those areas can leave gaps in other areas. If you're really good at performing an ELISA test in a lab and you're applying for a research job, there is a high likelihood that everyone is good at that job. You can mention it, but then move on to what makes you, you. And words highlight and how great of a communicator or an effective leader you are. Those are good words to use. Common pitfalls that I've seen with cover letters, including some that I've written, would be a lack of originality. If you're applying for a clinical job, chances are that everybody has worked in a hospital. Find something unique about yourself, even if it is non-vet med related. I was able to transmute my experience in theater and film into a career as a veterinary journalist. But I had many people wonder why I included that detail on my resume to begin with. Second pitfall, failure to entice employers. Again, what is your why, your how, and your what? How did you handle adversity? How did you demonstrate leadership? What did you do to problem solve? One of the best ways, in my opinion, to entice employers on a cover letter is to convey to them that you have at least visited their website. What I like about this cover letter is that it states the why in the first paragraph. In the second paragraph, this applicant talks about their qualifications. I would have loved to see more about this applicant's unique background and why they would be ideal for that position. There are a dozen good cover letters and there are a bunch of bad cover letters. Are a CV and a resume the same thing? I used to think so. And I'm sure there's someone out there that can tell me that they are indeed the same thing. CV are for internships, academia, industry, and research. A CV also tends to have your GPA or class rank, details on research that you have done, publications, presentations. A CV also should, in most cases, come with a letter of reference versus just a list of references. You've got as many pages as you need on a CV, right? As many as you need. On a resume, shoot for about 2 pages. If perhaps veterinary medicine is your second career, then sure, definitely go 2 pages. But a resume can also be too scrunched and crowded if you're trying to make it short. If you have to take the font down to 8 and put it in Courier New, then it's probably too scrunched. On the other hand, 3 pages is probably not going to get a 10-second glance. If you have to use multiple staples to keep the pages together, or it's longer than the menu at the Cheesecake Factory, it's probably way too long. Keep all information super succinct and to the point. For instance, if you've done research or publications or presentations, it's vital that you mention it, but keep the information brief so it'll spark interest and your potential employer will ask about it. The interview. The interview can be nerve-wracking, but I firmly believe everyone can crush it. Very briefly, if you have trouble discussing your work experience, you can utilize the STAR approach. One of the most common types of interview questions asked these days are behaviorally based interview questions. And the idea is that past behavior is the best indicator of future behavior. An employer may ask a behaviorally based question. Tell me about yourself. Tell me about a time when A, B, or C happen. When you answer, try to frame it within this STAR approach. The situation, the task, the action you took, and then the result. And you can use the same framework when you're working on your resume, but I realize if you do this for every single experience you've had, you're not going to be able to keep it within those 2 pages that we talked about. So be careful with that. You can also utilize a popular improv technique for doing a comedy bit, except adapt it for your purposes doing an interview. It's called the what, so what, now what. The what? Clients are having trouble understanding how they could best help rehabilitate their pets at home after surgery. So what? That impeded the patient's recovery. Now what? I made a series of videos that the client can refer to on YouTube to help them understand how best to do it. Social media. Gone are the days of reading classified ads in the newspaper. Now all attention and research occurs online. Social media gives you an opportunity to research the practice, but also keep in mind it gives them an opportunity to research you. Most employers are still learning how to best use social media for their practice and to best demonstrate the personality of the practice and to convey to prospective candidates the benefits of working there. So you have to know how to reach them. More and more vet practices are using social media and web design as part of their standard portfolio of marketing tools. Common questions practices usually ask are, is it wise to use social media as a means of marketing their veterinary practice? How much time should we be devoted to improving our existing social media marketing strategy? Well, as a point of reference, in the UK and right here in the US of A, more than 80% of practices use social networking to advertise and or promote their services. This means social media can benefit both employees and employers. The way you use social media, personally, is going to be vastly different than how you use it as a marketing tool for your business. Whether you attract clients or job candidates, or whether you're an employer or an employee, you need to get them to notice you. Next, your messaging must be compelling enough for a cause to action. Click to learn more, call, email, text. These are all calls to action. So for any hospital, social media is a great way to stand out, and the best way to do that is through a well-written description and classified ad that not only describes the opportunity available, but highlights why your hospital is the best place to work. This can include benefits, flexible hours, technology, and facilities, your current employees, clientele, the location, and especially work-life balance. After the message is agreed upon and finessed, then it's time to think about a strategy and how to best spread your message. Ironically, the practice that is advertising should explain their why, their how, and their what. In this case, the roles are a bit reversed. So, which social media platforms are the best? While there's hundreds of social media networks, the best platforms to reach and connect with possible candidates are LinkedIn, Facebook, and Instagram. All three networks allow for targeted ad campaigns, groups to connect with one another, and lots of sharing capabilities. So employees, colleagues, and classmates can distribute open positions and opportunities amongst individuals with some commonality. Facebook. Facebook has over 1.5 billion daily users. It's a very visual platform, so you have to have eye-catching photos to attract your business. In addition to a powerful message and attention-grabbing photo, to truly reach your ideal candidate, you may have to invest in paid ads. At the beginning of 2018, every business on Facebook had to utilize Facebook ads for their content to have the broadest reach and to be seen by the maximum amount of users, followers, and prospective clients. Potentially, an effective way for an employer to use Facebook is to utilize Facebook groups. Any employee at the practice or business who are active in these groups can share the job opportunities and provide their reasons why it's a great place to work, including flexible hours, benefits, the level of care provided, and the clientele. LinkedIn. Well, you've heard of the phrase, your network is your net worth, right? Well, that's not exactly true, but for all intents and purposes, LinkedIn is based on that concept. LinkedIn is a social networking tool for professionals across industries, and it continues to grow exponentially every year. I almost never shared or posted anything on LinkedIn, but after I did, I ended up connecting with all of these tremendously inspiring people. If you're on LinkedIn, you can make connections with previous and current colleagues, classmates, and mentors. You upload resumes, apply for jobs, join groups within their industry and network. Not every veterinarian or industry professional on LinkedIn is looking for a new job opportunity. Now, these are called passive candidates. A passive candidate is one that isn't necessarily looking for a job. But these candidates can be intrigued by a well-written job description, post, or ad. Oftentimes, job seekers may not be the candidate you want to hire. According to LinkedIn, the company itself, 75% of the candidates a business wants to hire are passive candidates. What I love about LinkedIn is that they have ads that can be targeted to a desired candidate with specific demographic information, including location, education, career experience, professional groups, etc. There's also a nice feature that LinkedIn has where they send you matches and give you the opportunity to reach out to individuals that fit the description of your ad. You've heard of doing it for the gram, right? Well, there's a reason for that. Instagram, or the gram, as I affectionately call it, has over 1 billion monthly users. Instagram is slightly different than Facebook and in LinkedIn, of course, in that the feel is a bit different. You could potentially use it to post job opportunities or to look for job opportunities, but this platform is more about showcasing your company's culture, the brand, the look, the feel. Yes, doctors and lab coats, not so much, and more French bulldogs dressed as doctors wearing a lab coat. And if you don't know what you're doing with Instagram, you can learn, or you can get the most social media savvy employee at your practice to manage the page. They can share photos of what it's like to work at your hospital every day and highlight the gratification, the medicine, the facility itself, and the patients. Hearing from current employees and viewing behind the scenes photos and videos can help motivate and attract candidates. And now that hashtags are searchable, they are an essential component to any post that you want to have broad reach. Let's talk a bit about inclusion. How do we save lives in medicine? Practice with the best evidence-based medicine, with state-of-the-art procedures, with teams of nurses and doctors working together with the most compassionate bedside care. But there's one more thing, and that's diversity. Diversity helps us to do everything we do in veterinary medicine, but better. Consider the evidence we've learned from our human colleagues on the other side. For example, female physicians are more likely to follow evidence-based guidelines. African American physicians are less likely to harbor negative racial bias against other groups. Minority patients are more likely to follow recommendations from physicians who share their background. And diverse research teams are more likely to use innovative solutions to solve problems. In fact, doctors who come from diverse medical schools rate themselves as being more comfortable treating patients from diverse backgrounds. So it's simple. In order to practice the best medicine, we need the best evidence, the best procedures, the best instruments, compassionate teams of veterinary medical providers with diverse backgrounds. Fortunately, veterinary medicine is starting to have a better gender balance. According to market statistics, over 60% of veterinarians are women and represent 60% of veterinarians working in private practice. Women-owned businesses have increased by 58% over the past 10 years, surpassing 12% growth in new firms overall, with total revenues increasing to 46%. Women-owned businesses currently represent 4 out of every 10 businesses in the United States. And trends seem to be likely to continue, with recent stats indicating the amount of applicants mirrors the current enrollment gender demographic of veterinary schools. But for males, the applications are actually declining. I do remain hopeful. Many are starting to realize that diversifying the workforce can literally be a life or death mandate within veterinary medicine. Again, extrapolating from other healthcare fields, we know that underrepresented minorities do not get the same level of high quality level of veterinary care across the nation. The true numbers may be even more stark than the statistics from the human medical field due to the lack of widespread veterinary insurance coverage. An important strategy would be to diversify the veterinary medical workforce. But how do we do that? We try to decrease our unconscious bias. Here are some strategies. These strategies for reducing unconscious bias can be utilized if you're looking to be an employee or if you're an employer. The goal is to have a team that works together in harmony. So let's go through some of the tips right now. Commonality. Don't give up when you're interacting with that person until you find a commonality that you both share. You'll see people do this all the time when they first meet each other. They may ask each other details until they find something that they both have in common. You might ask someone, "Where are you from?" And if the person says, "Connecticut," you might say, "Oh, that's great, because my great-granddaughter's nephew's cousin went to Connecticut one time when she was driving through to go to Maine for school." Now you have something in common. Maybe you both like the same food, the same sports, the same breed or animal, but once you find that common identity, then that will reduce the impact of inherent bias. Empathy. Empathy actively opposes unconscious bias. Developing empathy or understanding their perspective can actually reduce the unconscious bias that you have against someone. As you're interacting with someone, or while you're going through your interview, as an employer, you can think about what that interviewee is going through, all the things that they went through before they got to you in that interview. But as an applicant, you can think about what kinds of things might a business owner be looking for. What kinds of struggles or challenges might a business owner have, and then obviously tailor your talents or your conversation about your talents towards those challenges. It's that you might imagine these businesses have. And once you imagine what they have, you can take their perspective, and that empathy impacts your unconscious bias. Devil's advocate. I say consider the opposite of what you're thinking. As you're considering information, ready to make a final conclusion, force yourself to go back through the information and consider a different perspective. Maybe you had a negative experience with someone from a particular demographic group. Remind yourself that broad, sweeping conclusions shouldn't be made about applicants based on what groups they identify with. All people have individual traits idiosyncrasies, and personal characteristics. In many cases, playing the devil's advocate or finding the opposing view blends into empathy or perspective taking. In certain instances, it may make your feelings more inveterate, or hopefully, it will change your mind to help erase your implicit bias. Counter stereotypical exemplars. Find someone from the group that you know you have an implicit bias against, but you enjoy their personality. For instance, if you know you have an implicit bias against African Americans, you should spend time with, go out to lunch with, converse with someone whose personality you actually enjoy, who happens to be African American. As an employee, the questions you ask are just as important as the questions that they ask you during that interview. A savvy interviewer who is genuinely interested in getting to know you and finding the right fit for their hospital will probably ask you, "So, what questions do you have for me? Do you have any questions?" Make sure you are prepared for it. So let's say you found that job and you're ready to sign. What's next? I would double check and make sure the expectations are clear. I've had jobs where the expectations change midway through the year and it catches you off guard. Anytime you have to say, "Wait, that's not in my contract," that's not a good sign. And unmet expectations, they lead to burnout. Although a contract is a legal promise between two parties, you shouldn't have to constantly refamiliarize yourself with the language in the agreement. So a couple of questions that are good to ask include, what do you mean by progressive or best medicine? These questions can apply to even non-traditional career pathways as well. Make sure you hear in granular detail what is required, because you might be walking your car at 9 p.m. at night reconsidering all the decisions you've ever made in life. So look, there are so many exciting opportunities out there for great, talented, trained, and bright veterinarians. We've just briefly touched on some of the exciting opportunities out there in conventional and untraditional pathways, the methods and the skills and the connections we can use to find those opportunities. And most importantly, we talked about how to highlight your passions, your interests, and your goals. The right job, yeah, it's definitely out there, but with these tools, you'll know where to find that dream job. You'll know exactly how to help them find you. So if you want to learn more, please download a free copy of Vet Career Guide at myvetcandy.com/career. Thanks, and we'll see you next time.